Okay, so you've seen the celebrity stories, Al Roker, Carnie Wilson, hundreds of pounds lost after gastric bypass surgery. But what are the risks? Dr. Gildy joins us to shed some light on the subject. Good morning, how are you?
Good morning, Susan.
Thanks for coming in this morning.
Thanks for having me.
We were just talking about all kinds of interesting stuff. That's what I love about my job is I can have a plastic surgeon here and ask them all kinds of quick free consultation. Exactly. Let's talk about the growth of this procedure. How popular has it become?
Well, gastric bypass surgery has been around for a long time. We've been doing this type of procedure for 15, 20 years, but it really has gained in popularity, and I think that now, in the last year, 2003, 10 times the number of procedures have been done as in the previous years.
Yeah, that has to really have a lot to do with all the celebrities that are talking about it too.
I think that, and also health care plans are starting to cover it more and more, so it's available to more people in the country.
That's interesting. How would you qualify for a gastric bypass?
Well, you have to meet several criteria. You have to be diagnosed with morbid obesity, which means that you weigh more than 50% of your ideal body weight. You need to be screened by your family physician or internist to see if you're at high risk for problems of obesity, such as diabetes, high blood pressure. And if so, then they can clear you to have surgery.
Okay, now, can you get it? You know, we're showing pictures of Carnie Wilson here. What a dramatic change in her life. And she has come out and talked so much about how her life has improved since this procedure. There's also, though, been criticism against these celebrities saying, why don't you diet and exercise like the rest of us? You're stapling your stomach closed. I mean, are you really solving the problem here?
Well, I would venture to guess that everybody who goes through a gastric bypass surgery has gone through dieting for many, many years, much more so than the average person. But there are certain other factors that come into morbid obesity. Food can be an addiction to many people, and so there's a lot of counseling and psychological screening that goes on prior to undergoing the procedure.
See, so to keep you from overeating again. I mean, can you stretch your stomach back out again?
Yes, it's interesting about the size of the stomach reduction. In the obese patient, their stomach can hold almost a gallon of food. Wow. And in the reduction surgery, the stomach is reduced down to about a third of a cup, quarter or a third of a cup, and so it's a big change for these patients.
So what are some of the things that they have to learn after having this surgery? Are they just allowed to eat little spoonfuls of food?
That's exactly right. Early on after the procedure, they're only able to eat 1 or 2 spoons of food at a time, and so their weight will really start to drop quickly. The average person will lose about 100 pounds over a year.
Let's talk about it. This is a side issue, and we're going to talk much more about recovery after losing a lot of weight tomorrow. But you also handle when a lot of people lose a lot of weight or they have babies, like me, trying to get the body back. What kind of procedures are there available to, whether you've done the gastric bypass or you've lost the weight on your own, to get the skin back where they used to be?
Well, gravity is relentless, and after you've lost that much weight, the primary procedures that are done are tummy tucks to get rid of the hanging abdominal skin, and then we also do things like thigh lifts, arm lifts. The faces, if they're sagging, we'll do a facelift on them afterward. Generally, insurance will cover the tummy tuck and sometimes the thigh lift.
Really? In what cases will they cover a tummy tuck?
Well, if you have chronic rashes underneath your tummy from yeast infections, they will cover that.
It's that bad if it folds over like that.
Exactly.
Because sometimes you can lose all the weight and you can look, smaller and be smaller in clothes, but you're still not happy with the way your body is.
That's right. You still got to be able to go to the beach.
Exactly. You still got to be able to go to the beach. Okay. If people want more information, there's a website on the screen, changesplasticsurgery.com.
Absolutely.
They can call that number. How do you see some surgery and it's done really well, and then I see some people's faces and I think, oh, who did that? How do you know?
I think the best way is to make sure that the person you're seeing is certified by the American Board of Plastic Surgery. And there's a little insignia. If you go on our website, you can see the insignia of being a member of the American Society for Plastic Surgeons. There are a lot of non-plastic surgeons doing this type of procedure, and the best safety for getting a good outcome is to make sure you go to someone who's qualified, who's trained for 8 years to do this type of surgery.
Okay, and referrals also help as well.
Absolutely.
Dr. Gildy, thank you so much for your time this morning. We appreciate it.
Thank you, Susan.
All right, you're welcome.